Hello, welcome to Warriors Within, where we amplify the voices of sickle cell warriors in their everyday journey. I am your host, Coco Chanel, here to guide you through the real, raw, and resilient stories of sickle cell warriors and their families' journey. I'm here with my wonderful guest, Doris Karina. How are you, Doris?
I am excited to be here.
Thank you for joining me. It's been a pleasure talking to you so far. I honestly, I just want to just tell me about yourself. Tell me your journey with sickle cell.
Oh my God, that's such a
Yeah.
charged question.
It is.
Where
It's
do
a
I
very
begin?
charged question.
Well, I can say my latest, I mean, my one of the first memories I have of having sickle cell was, of course, being in the emergency room around when I was about 5 years old.
Okay.
I know that I was in kindergarten. That's like the
The-
youngest recollection that I have in my head of my first experience. I couldn't, they called my mom from school because I couldn't get up from my chair because my legs were in so much pain. And I think that was the first time when I realized that, oh snap, like I'm different. Like this doesn't happen to any of my other classmates, you know?
Yeah.
And from there, I just remember that just became my second home, the hospital. And I mean, it took my family, thank God, I have a great support system from a very
Amazing.
early age. And yeah, they were the ones that helped me make it through.
So I now have to ask, I always ask this, what is your nationality?
Oh, I'm Dominican.
Now, we always know that the stigma, of course, of sickle cell is always just, African American. How do you find yourself beating the narrative of that? Like sickle cell, Dominican, I'm pretty sure everybody's like, huh?
Yeah,
What is, like, how?
100%. I feel that how do I beat that or, navigate that? By reminding them
Yeah.
that sickle cell is not just a black disease. They
Yeah.
tell me, oh, but you don't look black or you're not black.
Yeah.
Like, you sure you have sickle cell? You sure it's not another chronic illness? And I just have to remind them and educate them.
Yeah.
I find myself educating sometimes even nurses or doctors sometimes, as insane as that sounds.
Yeah, no, it's true.
I've had experiences years ago where in the emergency room where a doctor just looked at me and said, where are you from? And I said, oh, I'm Dominican, born and raised in New York, but, my family's from the Dominican Republic. You should, like he kind of gave me that look, like, you sure? I'm like, I think I would know if I'm from another country. Educating people, really.
And that's a real shocker. So I'm intrigued to know with your family background. So I understand both of your parents are Dominican, right? So how did they navigate with understanding, hey, my daughter has sickle cell? I'm pretty sure that was probably an eye opener to them and a new learning experience for them. Can you tell me about that journey with your parents?
Yeah, definitely. I mean, for both my parents, they were fairly young when they had me. And at first, when my mom got pregnant, they told her that, they did some testing and they said, well, the fetus isn't growing in the way that that it would normally grow or needed to. And they began to tell her that, you should abort because we think that this baby is coming with a lot of complications. But my mom actually asked them, okay, but what complication? And they never gave her a straightforward answer. They kept on dancing around the terms of, Down syndrome. Then they said that at one point they told her that I wasn't going to have a spine. If you could even, like, what?
Yeah, what?
They told her so many different things that just made her not believe anything and just say, well, you guys don't even know what you're talking about.
Yeah.
I'm going to have my daughter and God will give me what he intends for me to live out in this life. And if that's what I'm going to be given, then
that's it.
That's going to be our battle for,
Yeah.
But I was the first one born in both sides of the family with sickle cell disease. So no one knew what it was.
Wow.
To the extent where my father's parents were very, I would say, I don't want to be mean, but they were just very reluctant to believe that their son was a carrier for what in their minds was a black disease. Mind you, that was 38 years ago. So,
wow. Yeah. So medicine times, everything changed. Yeah.
So that created a lot of friction between, their relationship and all that. But once I was born and diagnosed at 3 months, they did tell my mom that they didn't think I would make it till 5 years old.
Oh, wow.
And I know I can't be the only warrior that has been on this
Okay,
Yeah.
definitely have not. Our
That's
eyes
like the
not.
song of our life. Oh, you're
Yes.
not gonna make it till you're 5. You're not gonna make it till you're, 6. I mean, 10, then 15, then
Yep, it keeps going up and up and
eventually
up.
I turned 20 and I just said, you know what? I am going to be here till God
Calls
decides
you
that I
home.
will not.
Exactly.
Yeah.
But that's a wonderful and crazy experience because I can only imagine like your parents because
Yeah.
growing up, I mean, my background story, I didn't know my son had sickle cell either until I actually, gave birth and everything. So were your parents in New York or in Dominican Republic when they had you?
No, they were in New York because I'm
Okay.
first generation immigrant.
Okay.
So they both migrated to New York and that's where they met, even though they were both from DR, but
Yeah.
they met in New York. And yeah, that's when they kind of all unfolded.
So how did your journey growing up in New York? And that's my next question because I always wonder about my warriors. How do you guys survive in cold climates? Like,
Yeah.
we stay in Florida, so granted we kind of we can manage a little bit differently. We get rain, we don't get the snow, the sleet, and the hail
You don't
and
get the
stuff.
extremes of it.
Yeah, but anytime I talk to any of my warriors that's from New York, especially because I know how extremely cold it can be. How did your parents manage to because that's a learning journey. You find out your baby is sickle cell anemic, and not only that, it's a disease that's, like you said, that's common within a certain community. So your family is like, whoa, we're learning about something that we aren't even supposed to be involved in, pretty much. But
in their heads, right?
Yes, and so they're learning and growing. So how did your parents manage with that? Because after finding out cold does not resonate with.
Well, I think in the beginning they didn't know it was such a big trigger. I think that was something that maybe in my teen years is when it became very prevalent. Like, okay, we're noticing a trend here. Whenever it's winter time, you get hospitalized way more.
Way more.
We're noticing that when you go to visit Dominican Republic, you don't get sick over there. So it was kind of like those situations like that made it clear to them and to myself.
Yeah.
In my teen years that, okay, wait, I might have to relocate. And it wasn't until recently when I moved to Florida about 4 years ago that I noticed how less frequent I began to get hospitalized during winter time, right? Because I mean, it does get chilly here, but obviously not as cold.
It's not as cold as it. We don't get negative degrees.
Honestly, I've asked myself that question about how did I survive in New York? I mean, I think it's one of those things that when you remove yourself from that weather situation is when you start to ask yourself,
how?
I was insane. Why didn't I leave earlier? This is crazy. Why would you put yourself through such cold?
Yes, I find it a difficult task for myself anytime because I'm from Michigan. So I have family back and forth, and I go back and forth with my son, and I find myself finding a hard mission to layer him up. And I never go during the winter times. I always go through spring and summer. I never go
Same,
fall.
I never go. I never visit when it's winter time.
Yeah, so those are little things and I can only understand and imagine how you probably felt as a kid because winter times you were probably enabled from going outside to play in the snow, do snow angels, things that you were probably everything else
that
your
every
friends
child would enjoy.
that would want to.
You wouldn't think twice had you not had a chronic illness.
Exactly.
And again, in essence, I love the winter. I love the cold, but when you have a chronic illness, it can be a very big trigger. Even for people that don't have a chronic illness, the cold will trigger some pains and aches here and there.
It definitely
So,
does.
adding a disease to it, just makes it more complicated. And it just sucks because for me, now looking back at when I lived in New York, winters for me was like a prison sentence. And I know that's an extreme thing to say.
I've heard it before.
But, well, I'm not glad that you've heard it before.
No,
but
I can relate.
Thank
So
you. I don't feel alone.
No, you don't feel, you're not alone.
But it just felt like a prison sentence because it was literally not being able to go outside as much as I would want to or like to. I love nature. I love just going out to the park, and I was just unable to do that without it triggering a massive pain crisis or pneumonia, acute chest. So I could still do those things, but then I would have to suffer the consequences.
Yes.
So, once I had my daughters, it was one of those things where my husband at the time would, it was tag team. Like, okay, he would be the one to take them outside to the snow and play, make snowmans, and I would just be home making the hot chocolate for when they got home.
Yeah, inside jobs.
Yeah.
So how do you manage being a mom and then going through crisis? Because let's take back to probably when your kids were younger.
Yeah.
That's usually like the time where it's a little bit more strenuous.
Intense,
Yes.
It's more, yeah.
So how did you manage, and how did you get your partner to understand, like, hey, like, this is what I have, this is what I'm going through? Like, how did you break that down with him?
I mean, honestly, my ex-husband, he was very understanding from day one.
That's beautiful.
He was actually, he hates when I say this, but we met, he worked in the sickle cell clinic.
Oh, that's beautiful. It's a love story.
And so he knew right on from the very beginning
what you were
who
going
he was
through.
dealing with.
Yes.
Which was refreshing because up until that point, the two previous people that I was trying to be in a relationship with, they, as soon as they heard the sickle cell term, it was like, oh, you got sick a lot.
Yeah.
And it was just,
it's a negative connotation on it.
Almost making it sound like if I need a nurse, partner.
Yeah.
It's like, well, I'm just letting you know so you are aware, but I don't need anything from you in that aspect.
Yeah.
But anyways, he was very supportive. Once we were pregnant, he did get tested for sickle cell because in the early stages, because I refused to have a child with sickle cell knowingly.
Yes.
And since I myself have sickle cell, I was brought up to even think that I would never be a mom.
Yeah.
Because they told me, all my doctors always told me, you're never going to survive the pregnancy. You're either going to die, in the
scare tactics.
Oh my God. Or you're going to, or the baby's going to die at birth, or you are, or the baby's going to be, or the baby's going to be drug dependent because of all the opioids you're on. It was just like one big, for me, it was always like, I'm never going to be a mom. And to some point, I began to believe it. And I even said, I don't want to be a mom. It's one of those things when they tell you you can't do something.
Yep, and you just believe it and accept it at that point.
Accepted it. And then once I did get pregnant, it was more like, oh, wow, okay. Like,
like we're here. It happened.
So he got tested and he turned out he was not a carrier for sickle cell.
Beautiful.
Amazing, because at that point, to be quite honest with you, I think, and this is 100% being real, I think I would have terminated my pregnancy. I don't think I would have had a child with sickle cell. And no shade on other women that knowingly go forward with that. To each their own. But yes, I'm here. Yes, I've survived. Yes, I look
amazing. Amazing.
No, but what I'm trying to say, I don't look like
what you've been through. Yes.
Which is amazing, but I cannot fathom putting my own child through the things that I've been through. So
no, as a mother, with a kid that has sickle cell, I completely understand. That's something I stand behind.
Yeah, you're not being able to like help your child.
Yeah, it draws the living like motherhood. I really do feel you. I try to tell him all the time, I wish I could take the pain from him, but there's no way you can do it because you feel so helpless. So I could totally understand, and I agree with you. I kind of vocalized that with myself too. I don't want to have another child like that unknowingly. Like I told you, I didn't know.
No, that's exactly.
So that was my only situation. But I'm pretty sure if I would have known, I probably would have took a whole different method myself.
Yeah.
So as far, like I said, with your children, how do you manage with your being a mother and then going in crisis and then like, your kids? I'm pretty sure your kids are probably like they have to cry.
Yeah, they did. I think up until they were maybe, let me not say that, because even recently when I tell them I got to go to the hospital, they're just like...
They get in their feelings.
And they get really nervous, like, oh, how long is it going to be this time? And things like that. But when they were younger, it was definitely very hard.
Yeah.
But I think that choosing your partner is choosing the right partner for you when you have a chronic illness is very important, because you have to choose someone that it's going to be there for you. And that's not just going to be like someone that's going to be like in the grave. It's not just going to be the how do you say? Sorry, sometimes I'm trying to
It's okay.
translate.
It's okay. You can say it in Spanish too. For my Spanish speakers, they understand. It helps out.
No, que va a estar ahí contigo en la buena y la mala. Like, that's gonna be in the pits of it. That's not just gonna be the typical dad that just, works the 9 to 5 and the mom's at home. Like, no, there's gonna be moments where he would get home from work and I would be in bed. I couldn't move, paralyzed from the pain, and he would have to go into mother and father mode.
Yes.
And also my family. I think that had I not had the support system of my family, I dare say I probably wouldn't have chosen to continue my pregnancy either. Because that is, I don't think I would have survived it. I don't think I would have survived it. And with that said, that doesn't mean that, I had my child because I said, oh no, my mom's going to be there. She was there in all the moments that I was sick. But I was not that parent either, or that mother where it was like, oh, I'm going shopping here, mom, or mom, I'm going out this weekend. No. But they were always there.
Yeah,
whenever I was sick. So that's how I made it through those years, because
your support system.
Yeah, and when the baby's a few months old to
you're tired,
5, 6, 7 years old, that's when they require the most attention the most just your energy, your attention, so
is there like system. I want to ask, is there something that you recall going through while you were pregnant and you it was probably hard? Because I have interviewed a couple ladies before and they explained to me pregnancy and being sickle cell anemic is pretty hard. One of them I have interviewed, and she has explained that she has went into a crisis while being pregnant before, and I can only imagine. And the mind span between you, your baby, myself. So, did you notice any change? When you did go through your pregnancy, from opposed to when you weren't pregnant to being pregnant.
Yeah, I think one of the things I struggled with the most was my opioid intake while I was pregnant. Just because I was more, when you have a baby, inside of your tummy, anything you take, even food.
Yeah,
I mean, if you eat something spicy, the baby is going to get, hiccups or whatever, like stomachache. So I was very mindful of that every time I would take pain medicine. And because the doctors had instilled just in my brain, they would just, the baby, there's a 90% chance that your child's gonna be opioid dependency and addicted to the drugs when it's born, and it might have to be in an incubator for a couple of months. And that shit, I'm sorry,
it does. It will scare the living crap out of you.
So, because then you start thinking about those news of drug addicts, women pregnant,
and then you think about the baby,
and then oh my God, is my child gonna be like this? And so for me, that struggle, I would sometimes struggle with enduring the pain and not taking
your medicine,
my pain meds. But then I learned that also the pain can also. They feel it.
They feel it. I was going to ask that.
Yeah. I had this one doctor that I explained to him. I said, listen, because he would tell me, why are you not taking your pain meds? That's what it's for. And I said, I just can't take it knowing that my child is going to be under the effects of it. And I don't know how that's going to affect my fetus,
No, for sure. And I would have had the same questions.
Yeah, it was just really difficult. But then he explained that having too much pain, the baby's also feeling it. So I had to kind of
balance it out.
Balance it. If I would take 10 milligrams before being pregnant, I would only take 5. So I had to find that sweet spot where I was,
you're comfortable enough.
That is the word.
Because you have to be, because pregnancy isn't easy to begin with. And then to add a sickness on top of being pregnant, oh my goodness.
I was high risk from the beginning, because we all are. Any sickle cell warrior, that's a pregnant, we're automatically high risk.
Yes.
And I think I was pretty much home a lot because, and thank God, their dad was able to economically, support us through those 9 months, and more, because then after you give birth, you have 3 months.
Exactly. You're just still on bed rest. Is there anything that you would like to make more awareness in with the sickle cell community?
Well, there's so many things.
I know. I say that all the time. Like, it's a list full of things that we can make more awareness of. But we always say, like I always say in the beginning, everybody's voice is literally the step in the changes to everything else that we put forth. Every single one I've interviewed, your voice literally have made an impact. So that's why I say your voice literally is probably going to make the biggest impact on somebody you don't even know. So that's like, what do you feel would be the change that you would love to see or implement the change with the sickle cell community?
I mean, like you just said, every voice is important and needs to be, heard. And they're so different, right?
Yeah.
Because although we all have the same chronic illness, we have such different manifestations of the disease. So I think more transparency, more just, I don't like when I see warriors that are, how do you say, like embarrassed of having sickle cell. I mean, granted, I know I'm very vocal about my chronic illness. I've been advocating since I was 15, volunteering, and now I work as a community health worker for sickle cell patients. So I've seen a lot of, I'll meet you in the street and I'm just like, hey, do you know what sickle cell is? And I'll just start
I love it though.
So I know not everyone is as vocal about it, but I would like to see people just, that taboo of not, like it's a world disease. Like it's not just Black people that have it. I mean, like, can we get that?
Get that stigma out of our head. It is.
Brain.
I always go with that because I say that it's a sickle cell anemia has a certain stigma that literally goes with you guys for the longest.
Yes.
And it sucks because, like I said, each one I've interviewed, everybody's different. Like your story is so different from everybody else's. So I want to know, can you tell me about a time like where you've been hospitalized and you feel like that stigma, like we were just talking about, the Black narrative, the drug codependency. Can you tell me about Can you tell me about a time like you went through anything like that?
Yes, unfortunately, I have many experiences, but I would say the one that stands out the most would be about 5 years ago, about a year before I left New York. I was having a surgery to get a pick put into my arm because my veins, as you know,
they collapsed.
Yeah. So I went into surgery in the morning, and you're not supposed to eat or drink anything before the surgery. So I go and I tell the nurse, hey, I haven't taken my morning meds, which at that moment was methadone in the morning, 20 milligrams. So I told her, I'm in a little bit of pain, but I haven't taken it because I know you guys said not to drink anything. So she said, oh no, you could drink it. Like right after you come out of the OR, I'll bring you some water and you can drink it. Okay, perfect, fine. So I already made her aware that I'm going to drink my pain meds, right? So I go in, they put the PICC line in, whatever. I'm recuperating. I was put to sleep because I suffer from I get very anxious because of all the...
Yeah, it's a nervous factor when you start to go into those things.
And I've had so many traumatic other events that any simple procedure, I have to be put to sleep. There's no but or ifs, there's just no.
Yeah.
Anyways, so I come out of the procedure and I'm in the bed. There's also a lot of other, it's not in a room. It's like after you come out of the OR, they kind of put you all together.
Yeah, they do.
So I'm there and I'm by myself and I tell the nurse, like, hey, can I drink my medicine? I have it in my purse. And she goes, oh, sure. She brings me water. She sees me drinking my pain meds, right? I drink it. Maybe 20 minutes after that, or less than 30 minutes after, I get up to go to the restroom. I take my purse with me, because I know this will be TMI, but, I had my cycle during that moment, so I grab my purse so I can go, handle that. So I walk into the bathroom, and I guess I took a little longer than she liked. I was in the restroom. Also, my partner at the time was going to go pick me up. So, I was putting on, fixing my face. I just came out of the operating room. So, you kind of look crazy.
Yeah,
so
you want to look decent. Yeah.
And nobody was out there trying to use the bathroom, so I was taking my time. She's knocking on the door of the bathroom. Hey, are you okay in there? Yes, miss, I even said for her to leave me alone. I even said, yes, I'm pooping. Like, leave me alone.
Yeah, like give me my privacy, lady.
Because I didn't know that she had
Yeah.
knocked already twice by that point. So in my defense, I was like, okay, let me just tell her that I'm
Yeah.
just so she could leave me
Yeah,
alone.
leave you alone.
When I come out of, so while I'm in the bathroom, I start to feel a little drowsy because of the pain medication.
Yeah.
And also, I'm still a little bit loopy
Exactly.
from the anesthesia that they put in my
Exactly.
system. So I grab my purse, I'm leaving the restroom. She's outside the restroom with another nurse. And she's not helping me to walk or anything. She's just kind of staring at me. I remember I'm still kind of loopy.
Yeah.
I just took my payments, which she was aware of. I walked to my bedside. But I guess I started to, like, you know, do the whole wobble, drowsy thing. I sat on my bed, put my purse next to me, and at that point, I know other warriors can relate. When we drink a certain amount of pain meds, we sometimes fall asleep sitting down.
Yeah.
I do that all the time when I'm in a lot of pain, to the point where my daughters sometimes, if they see me in bed,
they lay you down.
Lay me down.
Yeah.
Which I hate, but that's another story. So I'm sitting, I guess I was sleeping, sitting down on the bed, and next thing I know, a security police personnel walks next to my bed and says, "Is that your purse?" And I said, again, I'm loopy, right? Yeah, that's my purse. Oh, you need to come with me. Okay, what for? Oh, you just need to come with me. He was nice about it, because again, you know, he's just that's his job.
Yeah, his job.
I said, yeah, that's in my head at that moment. I'm thinking, oh wow, maybe somebody stole something. You know, that's the first thing I'm thinking of. The last thing I'm thinking is what they were trying to accuse me of.
Yeah.
So he walks me into like this conference room. I still have my gown on. He's holding my purse. He's holding me because at this point I have full effect medication that I just took. So I go into the conference room and he sits me down. He goes, always, you know, can I open your purse? And I said, yeah, you can, but what for? You're still not telling me. Like, at this point, I'm getting agitated. I'm like, okay, but I don't mind you checking my bag, but you need to give me a reason. Oh, you know, I don't know. He was kind of like just avoiding, whatever. He starts taking things out of my purse and putting it on the table. You know, I'm not hiding anything.
Yeah.
He takes out my medicines. He takes out nothing that like I wasn't supposed to be carrying. So then the another, I guess the nurse, manager, charge nurse, whatever you call them, walks in and says, "Oh, you know, we're here." And she's, at this point, I'm like upset, but I'm trying to be respectful because I know if I start yelling, you know,
yeah, it's a whole nother.
Right away, you're labeled as crazy,
Yep.
and it's like, even if you're telling the truth or if you're at right, it X's out
Yep, it X's out everything.
So she begins to tell me, oh, your nurse was concerned about you because she said that you walked into the bathroom fine and that when you walked out, you were very loopy. Like you looked like you were under the effect of drugs. And I remember just staring at her, like literally, I just stared at her. And I just started to cry. Because
they're overbearing.
And I was just like, did she forget to mention that I made her aware that I was going to take my medication? That on top of, you know, the anesthesia you guys gave me also makes me loopy and, you know.
Yeah.
Oh, well, you know, it was out of concern. She just was concerned that, you know, you went in the bathroom and you were in there for quite some time. So I still was like,
what was the...
Well, you know, we've had patients that have gone into the bathroom and they shoot up and they do... And I was just...
Yeah, that doesn't...
I just had like
that doesn't apply to...
surgery. Like, yes. I'm just like... And I just... it took me so many years from when I started opioids to not consider myself as a drug addict, especially in those moments.
Yeah.
Where I feel, you know, where I catch myself falling asleep sitting down on my bed. Or when I catch myself, you know, having a conversation with my kid. And she goes, Mom, are you asleep? Because you keep on
nodding out.
Going like that. So it's hard to like have those experiences and not think of yourself as
Yeah.
a drug addict. And then, you know, the movies, the videos,
Yeah, and everything else.
doesn't help. So in that moment, it was just like, I just had a panic attack. I was just like, what? No, why would you think that I'm like, what?
Yeah, it's
Just one of those moments that she doesn't know what she undid in that moment. She just reminded me of all those things that, you know, I've always been labeled, or we've always been labeled
Yeah.
as drug seekers, and just like, what?
Yeah, it's a horror. That's why I said that's a. First of all, I'm sorry that you had to go through that because that is a horrible experience. I'm pretty sure, like I said, all my warriors that have sat down and talked to me, they all have went through some
Yeah, I know, and it's
unbearing
unfortunate.
stories, and it's really unfortunate because there's certain things that you would think that in the health field they have certain practices that they could, you know, be a little bit more
Navigate it better. If she
Yeah.
was so concerned about my well-being, she could have asked me.
Yeah.
Hey, and I even told her, I said, if she was so concerned,
Yeah, she could have,
she could have navigated this way differently.
of
She could have
course.
asked me.
Yes.
What happened to asking each other?
And then, yeah, and it never works out like that.
So, and then after that, I went to the board. I educated the shit out of those people.
I love it. I
you know,
love
so
it.
I turned that situation and
It's a positive.
they didn't think I was coming back. Oh, I went back.
That's good.
Respectfully with a bunch of, you know, pamphlets, and I was like, you guys need to do better.
Yeah, no, that's good. I love the fact that you made it something a negative situation into something positive.
Yeah.
So is there I know I kind of asked, I think I asked this in another way. What ways do you go about making awareness for sickle cell? Obviously that's one, because that story right there just said it all.
I think the best way is just asking people, random people, hey, do you know your gene status?
Yeah.
Do you know if you're a carrier?
And giving them pamphlets like you did. 'Cause,
Pamphlets,
girl, that
and
pamphlet.
listen, I have this cardboard in my car. My daughters are always like embarrassed, but I wrote, do you know your gene status? And sometimes like if we're at the beach or something, I'll take it out and I'll put it next to us.
I love that.
Do you know your sickle cell gene? Just advocating and just educating people to get tested.
Yes.
Get tested.
Yes.
Now, you do with
Yes.
that information what you please.
Yes.
But at least you know where you stand.
No, that is I
know?
totally agree. I'm a big advocate for getting tested too. So
Yeah.
hopefully one day we're gonna advocate together
Yes.
for that.
We
I
shall.
appreciate you for sharing your story, for coming on here and being transparent. Like I said, resilient. That we love the warriors that come on for that. And I'm gonna wrap up this episode. Is there anything that you would want to say to our warriors?
I think the one thing I just want to emphasize is, you know, you got this. Hey, you're not alone. Sorry.
No, I love it. They're never alone.
You're not alone. There's way more people that, you know, can understand you on deeper levels than you can imagine. Just reach out to your community. Google, you know,
Yeah.
sickle cell organizations near me. Tap into this awesome community that so many people that are willing to help, not just sickle cell warriors, but caregivers,
Yeah.
doctors, nurses. There's so many amazing people out there that are
It is.
willing to fight this fight with us. So don't feel alone and just reach out. I mean,
Literally.
even with this amazing YouTube channel, you know, this is
Reach
an
out.
awesome resource.
Yeah.
So thank you, Coco. Thank
Thank
you
you.
for, you know, this organization for having me and for just making our voices be heard.
Yes, and that's what we want to amplify. So I'm going to thank you guys for tuning into this episode, and thank you for listening to the Warriors Within's voices, because they do need to be heard.